Hello, I'm Vivian. Welcome to my channel. This is a continuation on PCOS and some of the symptoms that may go with it. Part of mine was elevated testosterone. And a lot of people with PCOS will also women will start getting facial hair, manly facial hair. I recently saw a young, it just broke my heart. And she was beautiful skin otherwise, but you can tell she shaved because she had very white skin and dark black hair. So it was very noticeable. And even though she had makeup on, and I wanted to talk to her, but I didn't know her. I didn't want to, and she was working, so I didn't want to interfere with her job and make her feel uncomfortable anyway. But I wanted to just talk to her and see what she's, what she knew so far about her condition, what she's been doing about it, or if anything at all. And so, I remember getting one chin hair when I was like 16. It was just like all of a sudden there it was. And this is not a comfortable topic, and a lot of us won't talk about this because it's shameful. It's very unfeminine, to get manly chin hairs. And yet, I think we all see many women with it. And I notice a lot of times when women are going like this, they're feeling to see if one's popped up. Because a lot of times, we don't see it, but we can feel it. It's there. Or like the light hits it right, and there's this I had this one, and it's like, it looks like lint. And I look for it. Periodically, I check and I look, I'm looking around, and I don't see it. And then all of a sudden, it's like that long. What the heck? It's crazy. So, yeah, let's get down and dirty about this kind of stuff. My wonderful daughter started seeing a esthetician with laser hair removal. And she was just, underarms and bikini. And I'm not going to go into details about what she's having done for herself. But she bought me a package this year as part of my Christmas and birthday present. It wasn't cheap, so I really appreciate it. I wasn't going to do it. I actually bought something for myself that I was using here. It was a home thing, and I got it from Bed Bath & Beyond. It was like $300. I spent my birthday Christmas money on it one year. And it came with 2 light bulbs, so I'm on the second bulb now. And it worked great for fine hairs. So like I was getting, there was on both sides, like a dark hair was coming. They were fine still, they were very fine. Like, when little kids start getting that little mustache. So that was kind of an issue. So I had bleached, I've waxed. And then as we get older, this doesn't stop growing. I'm not talking the hair. The sideburn starts growing coarse hair down this way too. So, and I was noticing the darker, longer hair. It wasn't coarse yet, but it was longer. And that home laser thing worked on those hairs, but it did not work on coarse, like manly hairs. It didn't work on those. And it doesn't work on the hairs that's turned gray. So, and it didn't work on this thing that pops up every so often. So that's going to be, probably for the rest of my life, I'll just notice a huge lint, it wasn't there yesterday and there it is today. The indignities of getting older is indignant. So the elevated testosterone, I was diagnosed with that. Definitely, it's like, yeah, definitely. I'm getting, there was more than one chin hair. It's like, that one chin hair would pop up every so often. I'd pull it out, no big deal. And then it's like, oh, I'm almost growing a beard. And I could see the other hairs that used to be fine was getting coarse, darker and longer. So, went to the doctors about that. And they put me on birth control pills. And I was also dealing with very heavy periods. Sorry guys, if you're all listening to this. If you have women with these things, that you may have to listen through this and get some information that may be able to help her if she's depressed and just giving up. I see a lot of women like that too. I almost went there. But I was starting to have very, very heavy periods. And if I coughed, that was it. No pad or tampon was going to keep that from overflowing. So I had to change clothes at work. I kept a change of clothes in the car during that time. I double padded. I mean, there was a lot of stuff. And then as years progressed, it went from one day I would have, and it was clockwork. It's like every 4 weeks I had my period, lasted for 7 days. First day was light, then the rest of the days were heavy into the last day. But one day in the middle was really dangerous, and I passed huge clots. Dealing with anemia during that time too, because I was slightly anemic all the time, and during that time it was bad. So then it got to where it was like 3 days. I wouldn't even go to church during those times because I was scared I was going to mess up one of those cloth-covered seats. And if I did go to church, I sat in one of the vinyl seats in the back, or another room. It was that bad. And if I sneezed or got up after sitting a long time, and when I get up, it's like, gush. I'm serious. I know I don't have a big channel, so I know I'm not affecting too many people with this, but I feel like this is important. This is how I would talk to my girlfriend. And it had gotten to the point, and I did not want a hysterectomy. A hysterectomy was recommended. I did, because I knew if I had a hysterectomy, I knew that there were options. Just have just the uterus removed instead of having everything removed. I wouldn't have to go on hormone therapy. But I was scared that it was going to snowball, that, I'd get the uterus removed and had to get the ovaries removed later. And I just didn't want to start that path. My mom had her full hysterectomy in her early 40s, I believe. I'm not sure exactly when. But I was still in high school when she had that done. So I was housebound. I did not leave the house unless I absolutely had to during those 3 or 4 days. It was debilitating. And talking in a women's group, one of the women's there was getting an ablation, a uterine ablation done. And I didn't understand what that was. And she explained it to me. And I was like, oh, wow, that's maybe something I need to look into. And she had it done, and she was like, oh my God, what a difference. Basically, they burn the inner lining of the uterus out. So everything stays put. It's an outpatient procedure. So I went and made sure, saw a doctor about this, and my GYN referred me on to a local specialist that did that, women's clinic here. And, they're like, oh yeah. And that's when I had the pelvic scan done, and that's when I found out my ovaries were completely clean, no cysts. There's no polycystic ovarian syndrome was not my problem. There was no cysts in my ovaries. And that, the name revolves around that. And now I think they're classifying a lot of women that don't have PCOS but have all these other symptoms as PCOS, because, like I said in the other video, they're only treating the symptoms. So they don't really care what is the underlying cause. I care what the underlying cause is. I want to know what's wrong, and I want that fixed. I don't want a Band-Aid on it. And so I ended up having the ablation procedure done. They also really, really push. But I was done with childbearing. I didn't want more kids. So that was, they offered to put a plastic plug in the fallopian tube to my uterus while he's up there doing all that other stuff, to put these plastic things and block it so no eggs could come through. because once you have an ablation procedure done, it's very dangerous. You're not going to be able to carry the baby full term. So getting pregnant can be very dangerous for the mother too, for the woman. So they don't want you getting pregnant. Do not get pregnant after an ablation procedure. So my husband and I discussed, we had all this stuff. We were discussing this. We had time before the procedure, and we decided not to do. I didn't want 2 pieces of plastic in my body. Go figure. I'm sure it was safe. It may not have caused me any problems. It may not cause anybody any problems. I don't know. But I just didn't want that. Just the thought of that now just kind of not a comforting feeling thinking about that. But they found some fibroids. There was one that was probably what was causing my heavy periods and the sloughing off of. It looked like raw liver coming out of me. It was bad. So we had the procedure done. I didn't even need the pain medicines that night. It was fine. It was good. I mean, I'm so glad I had it done. And 90% of the women who have it done never have a period again. They're done. They don't have a period. Again, I fell into the other. So I had a period. Again, clockwork. But this time they were normal. They weren't heavy flows. I didn't have to worry about sneezing or standing after sitting for a long time. I didn't have to worry about sloughing off of big pieces coming out of me. So I wouldn't have been aware of that procedure if she hadn't shared. And I don't know, I don't know what you know or don't know. And that's an option instead of getting a hysterectomy, which, again, a lot of women that have the hysterectomies will then again have a prolapse vagina later, and they have to go back and get surgery to get that put back right. And hopefully that's not going to be any problem for me. And so I avoided that down the road to look forward to. So the ablation, I also want to share some things that were, I thought, very interesting. I used to have very bad cramps. And I switched from instant coffee to brewed coffee. Now, instant was a lot easier. We didn't want to make a pot. We weren't big coffee drinkers then. And I went from using, just heating up some water and making my instant thing, to actually brewing a cup of coffee for myself. And the cramps stopped. I noticed a big connection between the days I had, the monthlies I would have when I drank instant coffee and the ones I didn't. I didn't have cramps. I would always get a low backache the day before, and then I would have cramps. It would definitely use some Midol or some aspirin, not aspirin, but something to help with that, because it was painful, and it did make me irritable. But then when I quit drinking instant, I just quit and started doing regular coffee, brewed coffee. No more cramps, no more back pain. The only downside was I no longer knew. I could tell by the calendar it was coming, but that back pain, that backache was my signal that, tomorrow. And actually, my husband was better about saying, you're going to have your period. I guess it was the way I acted, but it wasn't PMS. I was never a big, that wasn't an issue for me. I would have my own pains, but I wasn't PMSing. I didn't get mean, or it was something else. Anyway. And another thing, and why I don't like going, and this is a funny story, so if you don't want to hear this, you may just, the information stuff is stopped here that's going to really help you, or anybody else. The rest is just some things I went through. and why I made a certain call that some people are going, that's nuts, but that's why, partly why I did it. And so at this point, thanks for watching, and you can just go on, but definitely it's a female story. So several years ago, I went on a trip. I took my mom to New Jersey for her cousin's 70th birthday. And I ended up sharing a bathroom with 4 70-year-old women. My mom and her cousin and a couple of other ladies. So, okay, it was tiring. I was the chauffeur. They're talking Korean. I don't understand. So, I'm entertaining myself, reading books, doing shopping with them, being the gopher, carrying stuff. Sorry. I had a good time. I get back home. I have my annual GYN checkup. Now, I've gotten to the point where I understand almost every time I go, my pap smear comes up weird, and they send me a thing about going in a couple of more months and getting another pap smear because something came up that was abnormal. I was used to that. It's like I expect that now. Every time I go in and get it done, I say, if the labs come up with that, I'm not coming back for the second one. Because it's always come back the second time. Oh, everything's okay. This time, on a Friday, I get one of those notices about your lab report comes in the mail. It's a Friday. And I open it up, and it says, I have a sexually transmitted disease. I forgot which one it listed, but it said that my pap smear came back with this. And I need to call the doctor and tell them what pharmacy I want the antibiotic sent to, called into so I can go pick it up. I'm sitting there going, oh my God, I got an STD. I know I didn't do anything with somebody to get an STD. So I looked it up, and there is a small chance that you can pick this up from a damp towel, bath towel, that someone infected could infect someone else via the damp towel. I'm going, did one of those old ladies give me an STD? I am freaking out. I'm sitting there going, do I call this in? It's like, I'm just freaking out. I trust my husband. My husband and I have taken steps to affair-proof our marriage. So I went to him and I said, look, I just got this. And I know you didn't give this to me by, running around with somebody else. And he told me something. Oh my God. He said he knew I didn't run around on him. And just because, as you get to know me, I ask questions. I'm like, what makes you say that? Because you probably would tell me before you did it. And he's right. I would have told him before I went out with somebody else. But here we are on a Friday. I called and made an appointment for Monday morning to be in that office first thing in the morning to see my GYN. And so we spent the weekend. I thought I had it. And, like I said, I did the research. I thought I got it from one of those ladies, or did I pick it up from the toilet? I mean, if you can get it from cloth, I could have gotten it from the toilet. Could I have been the one to spread it among these 70-year-old women? I spent the weekend picturing how I was going to tell my mom I passed on an STD to her and her cousin. That they need to get checked. That was an awful weekend. And we kept our sense of humor. We were laughing about stuff. Fortunately, we have that good of a marriage and that much trust in each other to know what the other one's about. We're not So Monday morning, I go into the office, and she's like, well, why are you back? She didn't know. And I told her, because I got this notice. I didn't take the antibiotics. I didn't have it called in. I didn't do that. I want you to check. Again, find out, I want a second opinion. And she checked me, and she went to the lab, did this. Oh, you don't have that. You're not. Okay. If I had gone and taken the antibiotic, I would have been cleared. When she tested me Monday, it wouldn't have done any good, because the antibiotic would have cleared. I would have tested negative for that STD. And my husband would have gone in to get checked because his wife had an STD, which is what the normal procedure. He would have gone. And then he would have gone into the office and found out he didn't have an STD. His wife did. His wife came out positive for an STD. Can you imagine if our marriage was not that good? That is serious. And it's, I was laughing off the false results on the pap smears, and that happens to me. What am I supposed to take from that? What would you take? I like my doctors. It was the lab that messed up. She was, she had nothing to do with it. She did everything as she was supposed to do in treating me. And then I get that notice that I've got an STD. I've got it somewhere in my scrapbooking stuff, because I'm scrapbooking. I believe in scrapbooking all of life. I'm not hiding it. My kids, they don't really care about inheriting dozens and dozens of albums, but it's all going to be digitized. So it's going to be saved on an electronic format for them. And so I'm picturing one of my great-great-grandkids reading that story later. Because laughing is important. But oh my God, can you imagine if I had followed those instructions on that card and gotten the antibiotics? Seriously. And thank God I never had to tell my mom. Oh God. So, I can laugh that one off. I hope you found that funny and not too, but that's my life. It seems that those kind of odd things happen to me more than it should. I'm ready for normalcy. Even if it's boring, I want boring. Thanks for going to the end with me.